unlikely for you to get aspiration pneumonia on saliva in general, but much more unlikely for you to get it if your mouth is clear from bacteria from you brushing your teeth.
Okay, we're getting a couple of questions about Lsvt in the chat. Is it approved for MSA? And we have an Italian speech language professional is it recommended also for Dysarthria or only for Dysphonia? And excuse my pronunciation, I'm sorry. So whoever wants to take that, of those.
Jenny, you can take that. That was correct pronunciation, Elena.
Okay, all right, as far as Lsvt goes, I'm assuming the Italian speech pathologist, I'm wondering if you are certified in Lsvt or you're just asking, we'll see if you answer that question. I'm wondering if you are Lsvt certified, because if you are, you probably know that Lsvt is recommended specifically for Parkinson's disease. Okay, I see. Okay. Lee Silverman voice treatment is recommended specifically for Parkinson's disease. That's where the majority of the research is done. However, there's research done on a variety of other diseases that are neurodegenerative as well as like congenital. So for example, there's some research on CP and things like that. And with all diagnoses, there's been improvements with voice. So I would say that MSA, it would be useful for MSA as well. I've used the theory behind it and the exercises behind it for a variety of disorders. Basically, someone comes in with a voice issue and I do Lsvt-like exercises with all of them. Do we do exactly the same protocol? Maybe not with the same intensity, maybe not exactly the same frequency, but the exercise type, yes. And does it help with dysphonia or dysarthria? Yes, it's supposed to help with both, specifically dysphonia because it targets the vocal cords and the musculature at that level. However, again, the theory behind it is that you're over-enunciating, you're speaking clearly, you're speaking loud, and thereby improving the dysarthria or the slurred speech. I think I covered that, right?
Thank you. Thank you very much. Another question about Google Euphonia research project that is working with Google to help improve it. Either of you or both have comments on that or know about that?
I'm trying to scroll up on the chat and for some reason I can't. So can you just repeat Google what?
Can you inform the group? This was private to me, so sorry, you didn't get this. Can you inform the group about the Euphonia research project that is working with Google to help improve Google?
Oh.
You aware of that? Neither, okay. So that's not something, that our panelists are aware of right now. So sorry about that. Can't answer that directly. Let's see, improving Google speech. How about, what do you do with silent aspiration when you're supposed to get more NPO and don't totally want to? I do have a J tube.
Okay, so you do, and I'm not sure why I can't see the chat again, but.
Oh, you can, okay.
It's up a little bit.
Silent aspiration, yeah, this is up at 237.
Okay, for some reason I can only see like 240, but that's okay. So, so just to clarify, I think that the question was related to what you can do if you silently aspirate, and the recommendation was NPO. Was the recommendation from the speech therapist and the radiologist that you remain NPO?
Yes, she said yes.
Okay. But you're asking it what you can do sort of for pleasure feeds. I think that's probably what okay. So what I would recommend, and this is definitely, you know, as a speech therapist, there have been countless times where, based on the X-ray swallow study, which it sounds like is what you had, we see that food or liquid is going into the airway and that you're not feeling it. So the sensation is not there that something is going down the wrong way. So yeah, and when you say you're still hungry, so there's two elements to being hungry. So one of them is that your stomach is not full. In that case, you definitely need to reach out to the doctor and talk to them about changing your J-tube feedings. The second element to eating is the actual enjoyment of the food in your mouth and digesting it and the whole process of eating. So there's something called the free water protocol for people who really have severe aspiration, like they're not just intermittently aspirating, they're silently aspirating all the time. So in that case, if the study showed like a severe issue where you were silently aspirating all consistencies all the time, and you really want to stay well, you're not on the track towards hospice, but rather you want to just, be as safe as possible, then what I would recommend is brushing your teeth often and trying to stick to ice chips and the free water protocol, which would be brushing your teeth and then having little sips of water and ice chips, and having ice chips. Because what the research definitely shows that, so I'm wondering if what you're saying is are you aspirating the J-tube material, like the tube, you have reverse aspiration from the tube? Oh, okay. So if you're talking about eating and silently aspirating, okay. So the silent aspiration is frequent. So in other words, if you do eat, you're frequently aspirating. Okay, so then what I would say is you're gonna have to make a decision about how important eating is to you. If it's very important to you, then you need to know that you're taking a significant risk. If you want us to make some recommendations for some things that you could eat that would be less risky, then I can give you, I would say that you would wanna lean towards things that are thicker and that aren't gonna kind of cause agitation to you. It really would depend on how exactly your study went. What you could do is if the study was recent, you could reach out to the speech pathologist and talk to them about what specific foods and consistencies you had difficulty with and see if they can recommend anything specific. In terms of, if you really don't want to get aspiration pneumonia, because aspiration pneumonia can be fatal to someone who is already immunocompromised, then I would definitely stick to ice chips and small sips of water with good oral care. Jenny, do you have anything to add to that?
No, I mean, I think that was good. I think it just depends on your particular swallow study, so we can't really recommend anything without, possibly giving you something that's not correct or not safe. But yeah, I think you said it all. But feel free to email us too, and we can give you even more detail, for specific people's recommendations.
I think so, Marilee. I think you're saying that it sounds to me that maybe were you on a puree? Were you having aspiration with puree? Were you aspirating puree? You were, okay.
So Becca, I think maybe if you don't mind emailing us, I think if we can move on to some other questions, that would be good. And we can try to help you specifically through email, if that's okay.
Yeah, that sounds good.
Okay. Okay, we have a question about telemedicine, and this is from somebody asking about his wife doing telemed with her speech therapist, but she's not motivated to do her homework. How does one motivate her? We end up arguing if I push. That's a tricky one, I'm sure, but
yeah, that's tricky.
Motivational ideas.
Yeah. We'll try to answer a couple of these like a little more succinct so that we can get to some more questions, because I see there are a lot more. But as far as telemedicine goes, I'm wondering if maybe it's because of COVID, or maybe you're doing more of like a home health type of situation. But either way, I do a mix of both right now in clinic and telehealth. If you feel comfortable going to a clinic and you think that's a better way, you could do that. Otherwise, I think just making sure that you communicate with your wife and let her know that she's using her benefits and that you want to use them effectively. So in order to maximize the therapy sessions that you're having, you really want to do the homework in between. Otherwise, there's less carryover and things like that. It really depends on what the homework is as well. Like if you can make it like from a personal standpoint, please work on your speech because I love you and I want to hear your voice better, or please work on your swallowing so that we can have dinner together and really enjoy that filet one day. Those are the things I think that could help with motivation. I know it's hard though.
Or you can record, maybe if you can't, you can't get her to do the exercises with you, maybe you can record the telehealth sessions and have her repeat the telehealth sessions. That's another idea if you really can't get her to do them with you.
Those are great ideas. Okay, we have a question about scopolamine patch for excess saliva.
So it does, I'm just going to touch on that. So basically it does work for certain people. You got to check with your doctor to make sure it's not contraindicated. It's contraindicated for a lot of people on different medications. I can tell you that I have seen it help a lot, but it can also dry out your mouth completely and it can cause more harm than good. I think if it's not contraindicated, it's worth a try if you're having a lot of issues with the saliva.
So sort of the opposite problem is having dry mouth a lot. Question about that, and using a BiPAP and get dry mouth during the night, waking up coughing and choking. I changed humidity on the BiPAP, but it does not help. Waking up and having to drink a lot of water during the night.
Okay, my question for that would be maybe about dysphagia. It's hard to know if you also have swallowing difficulties. Because if you don't, I would recommend trying to stay hydrated more throughout the day. I guess either way, I'd recommend trying to stay hydrated throughout the day. And I know that's hard because like getting up and going to the bathroom in the middle of the night, no one wants to do that, especially when you have trouble getting around. But, you know, maybe even trying to time yourself. I sometimes recommend for hydration that patients set an alarm on their phone, try to even just take a little sip of water every 10 minutes or every 20 minutes so that they're more hydrated earlier in the day, and hopefully that'll help. We can't comment too much on the BiPAP, you know, because that's a little bit more physician oriented. So, but I think hydration should help with that.
And then just to add to that, to anyone dehydration is a big issue because of swallowing and many other issues. As people get older in general, they don't really notice that they're thirsty. So dehydration is a big issue. Some people have more trouble drinking with straws. Some people have less trouble drinking with straws. If you can drink with a straw, then you can get a lot more fluid in a little amount of time. So just something to think about for people. That's something that we definitely do with people is check and make sure that they're not coughing or choking when using a straw, tucking your chin if you need to, and trying it that way. You might be able to prevent that slippage down the wrong way, but you can definitely get more fluid quickly than if you're kind of trying to chug it from the side of a cup.
Okay, thank you. We have just a quick question about Botox for these, related to these issues. Either comments on that?
So I'm assuming the Botox question is related to Botox in the salivary gland. It could also be related to Botox in the jaw. I'm not sure what the question is referring to, but
Kevin, do you want to expound on that, or? It's from Kevin Kwok.
If it's really, so in general, I can say
Salivary.
Okay, so for salivary gland, what I would say is that you need to check with your doctor. You know, there is a little bit of a risk with any injection that you get in general. Botox wears off in 3 months. It can be the best thing for someone. So if it's really causing you, significant issues, then I would look into it. Talk to your doctor about it. But, when they're doing an injection in a gland, there can be issues.
Okay, so we have a few more minutes here. If anybody has any other questions to put in the chat. We are supposed to end this at 3 o'clock and have a break until 3:15, but if we can take a few more questions, then the next session will start on the video at the website at 3:15. That's on occupational and physical therapy. Any more questions here? Or any other comments, I guess, from Jenny or Becca? We have about 3 minutes left.
I think they want you to read. Isn't there a couple that were on a document before?
There are on the document. So, so we do have, what if I experience cricopharyngeal spasms after I eat? Is there something I can do to calm down my throat? Again, forgive the pronunciation.
That was pronounced right. Jenny, do you want to grab that one?
Yeah, I'll just say really quickly, that's a little bit specific. I think it depends on if you go see an ENT or a voice specialist, a speech pathologist that specializes in voice. You can get a scope, like a fees, and they can see your vocal cords and things like that and see like what the root of the problem is. But again, as a speech therapist bedside, we would probably recommend a diet change just to make sure that you're swallowing safely, not having the regurgitation. So again, that's pretty specific. I would ask a speech therapist in person for that one.
How about experience with communication devices? Do you have any recommendations on communication devices?
I mean, we touched on that a little bit in our presentation, but I would say in general, I would say that when you're looking to work with a speech therapist to find the right communication device for you, it's good to work with, if it's going to be a high-tech device, then a speech therapist will usually work with an assistive technology company. And a specialist at the company will work with the speech therapist to evaluate the type of device that's best based on the person's deficits and their strengths.
Okay. There may be some questions. I think we've gotten to everybody who had a question here. Is it harmful with atrophying vocal cords to continue to try talking or singing more? That just came in from Marilee.
So I would say in general, the answer I mean, it depends on the person, because if you have damage to your vocal cords, like physical damage to the physiology, then you definitely want to do some vocal rest. Which would be, not using your vocal cords as much, but for the most part, with people who have MSA, it's not really damage to the vocal cords, it's more of weakness, in which case you're using you're strengthening your muscles rather than causing damage to them, if that makes sense. I mean, it does depend on the person, but that's a general statement. Not sure if that helps.
So I guess that would probably depend on your ENT visit and what it looks like in your larynx to make that decision.
Yeah, so the ear, nose, and throat would do a scope and take a look down to make sure that your vocal cords aren't damaged. And then as long as there's no damage to them, then the exercises are good to do.
Okay. Thank you. And then, sorry, that was Joe, Marilee's husband, that was putting in those comments. There's a long comment from Joan Chi regarding Cure PSP and Lsvt Global partnering with Google on this Euphonia project. So I suggest everybody, if you can read that. Also, this is being recorded. Even the chat, the text can be documented, so you can come back to this. We know we couldn't get to every single question or every issue, but please stay in touch. And I really want to thank Becca and Jenny for their time and for everybody for participating. Thank you, everybody. Please join us in thanking them. Okay.
Thanks, guys.
Thank you so much, guys. Reach out to us if we can help with anything.
Thank you. And we will take a brief break, be back on the video commencing again at 3:15. Then there'll be another Q&A, the last Q&A session at 4 o'clock. So we'll see everybody in a few minutes. Thank you.
Thank you.
Thanks.